All right, welcome back everyone to Black Brain Trust. This is Black Tech Talk, episode 244. I'm here with my co-facilitators, Dr. Phoenix and Gabe.
Hey, how's it going?
All right. Please hit the like button as you come in. Share the video if possible. There's a doc in the description beneath the video for you to follow along with. Yeah, sorry we were delayed. Had to fire up the new panel and get the other one going. So, all right. So let me start sharing my screen. Actually, should be over here. No. I'll have that up. Um, oh, all right, just give me 1 second here. Not showing up for me. All right, we're good now. All right, so I wanted to have this discussion because the World Economic Forum was having this discussion based on the topics at hand in terms of fourth industrialization of emerging economies, and digital health was on the docket. So I think that's right in the realm of some of the stuff that we talk about in terms of data, healthcare, and cybersecurity. So with that being said, let me first share my screen so we understand what digital health is according to the FDA. All right, this is from the FDA.gov. So digital health is the broad scope of digital health includes categories such as mobile health, mHealth, health information technology, IT, wearable devices, telehealth, and telemedicine, and personalized medicine. Providers and other stakeholders are using digital health in their efforts to reduce inefficiencies, improve access, reduce costs, increase quality, and make medicine more personalized for patients. Patients and consumers can use digital health to better manage and track their health and wellness related activities. The use of technologies such as smartphones, social networks, internet applications is not only changing the way we communicate, but is also providing innovative ways for us to monitor our health and well-being and giving us greater access to information. Together, these have these advancements are leading to a convergence of people, information, technology, and connectivity to improve healthcare for all healthcare and health outcomes. Why is the FDA focusing on digital health? Many medical devices now have the ability to connect and communicate with other devices or systems. Devices that are already FDA approved or cleared are being updated to add digital features. New types of devices that already have these capabilities are being explored. Many stakeholders are involved in digital health activities, including patients, healthcare and practitioners, researchers, traditional medical devices, traditional medical device industry firms, and firms new to FDA regulatory requirements, such as mobile application developers. FDA's Center for Devices and Radiological Health is excited about these advances and the convergence of medical devices with connectivity and consumer technology. The following are topics in the digital health field on which the FDA has been working to provide clarity using practical approaches that balance benefits and risk. Wireless medical devices, mobile medical apps, health IT, telemedicine, medical device data systems, medical device interoperability, software as a medical device, SAMD, general wellness, cybersecurity, which is one of the reasons why we had this hangout, cybersecurity aspect of it as well. So how is FDA advancing digital health? The FDA Center for Devices and Radiological Health has established the Digital Health Program, which seeks to better protect and promote public health and provide continued regulatory clarity by fostering collaborations and enhancing outreach to digital health customers, and developing and implementing regulatory strategies and policies for digital health technologies. So we have a better understanding from a high level of what digital health is about. So I wanted to have this conversation so that we can better understand the opportunity that's going to be coming out of digital health. Dr. Phoenix works in healthcare himself, and Gabe and myself both work in cybersecurity. So we see the bigger picture, but we're going to try to bring everything down to layman's terms so that we have a better understanding of how this can actually benefit Black people as a whole. Dr. Phoenix, do you have anything to add in regards to digital health and what you're seeing in your day-to-day operations?
So actually, I will go back to even when I was an undergrad, and the project that I worked on as a McNair scholar was specifically built around using AI and specifically mobile imaging to diagnose diabetes and diabetic retinopathy. And specifically, the problem was to address issues of one, of underserved communities not having access to primary care providers, to get adequate diabetes treatment, and also to get care if they did have, for example, diabetic retinopathy. And just some quick facts about diabetic retinopathy. One, it's the number one cause of blindness in working age adults. And two, it is a complication of diabetes, but it also goes along with other diabetic ocular diseases such as wet dry AMD, macular degeneration, glaucoma, and oh my God, I totally got a brain part here. But again, so I'll just leave it at that in regards to eye diseases. But to continue with the project, so we used a camera system. It was a $50,000 camera system, and basically the system it uses a camera that uses LEDs to essentially paint a picture of your macula, which is your retina, which is the rear of your eye, which is in the back of your eye. And so what that did is allowed us to see the optic nerve, all the associated vessels of the eye, and we can start to see, and in the images, we could see if people had what we call microaneurysms. So in the event of people having diabetes, in that case, they would have these the blood vessels would burst, and they would and you can see like it would show up in the camera as little dark spots and stuff like that, or shadows, or actually it looks something very similar to if you've seen like soap scum on a shower or something like that. It looks similar to that. And so so we would use this, and the point was to make one, primary care and eye care accessible to communities that typically would not have access to this. So what the biggest aims of utilizing IT technology and stuff like that within the health system is, one, is to help reduce costs, two, to make it more accessible, and three, and to improve the health of population, specifically those that are underserved. And in healthcare, they call it the triple aim. It's population health, experience of care, and per capita cost. And so that's what we do in that's how one of the major applications of IT and tech within the health sector is being used. The other way is to also streamline a lot of the services, which goes, I'm sorry, excuse me, got some stuff going on in the background, which goes in, which goes along with reducing the overall cost on patients and the health system. As we know, current estimates put the GDP, put healthcare, the cost of healthcare between 20 and 25% of GDP in this country. And so again, when you're considering that, understanding that about 25% of every dollar spent is going towards healthcare, and that's in if you compare it to other industrialized countries, that's triple in many cases. So again, we spend a considerable amount of money in America on treating health conditions, but then again, we also see the least amount of advantageous outcomes in that regard. And so the other part of it is also utilizing it to when I spoke about streamlining health services. So we're thinking about using it to diagnose other diseases. So neurological diseases, neuropsychiatric diseases like Parkinson's or MS. Or you also using now, as you guys saw last year when Apple unveiled their new Apple Series watch, whatever series it was, but they had the guy that they had the MD, a brother who's a cardiologist, who was the president of the American Cardiology Association, or the American Cardiology Association, something like that. But anyhow, they had put in a EK. They actually put in a working EKG within their Apple Watch, so it can be used to monitor, abnormal heart rhythms. Also pick up on a particular type of heart rhythm condition known as atrial fibrillation, which is a condition that of an abnormal rhythm. And so that was one way we could use it, because you can have a wearable that can actually transmit information in real time back to Apple, and you can have people on staff who are looking at this information. So when you get if anyone has ever had any experience in the health system or had a family member that may have presented with some type of cardiovascular issue, they may have felt that they had some chest pains and they took them to the ER. The first thing that they did was actually they put them on the EKG. Why? Because we're looking at heart rhythms. That's the first thing we do. And Gabe can speak to this because obviously his wife is she's going to be starting CRNA school soon, and this is a big component if you're in critical care, if you're in emergency medicine and in anesthesia, being able to monitor heart rhythms and being able to catch when heart rhythms, as they, even before they happen, when things gotta happen, you'll see little things happen on that strip that kind of give you some indication that there's some type of cardiological pathology, going on that is abnormal. And so that's one way how Apple is using. But even and so they had it where they set up where you would enroll if you brought a watch, you would enroll in their program, and it will monitor and it will send your data back to Apple. And they're using this along with the American Heart Association, not Cardiology Association, Heart Association, they're looking at all data of, we're talking hundreds of thousands of people who have this newer version of the Apple Watch at the time, and they're looking at all this information they're getting from this built-in EKG within the watch, to be able to see just how what's happening with people's rhythms, even if you wear it while you sleep. Because again, cardiovascular issues show up when you sleep. A lot of people think that, you sleep because you're not really cognizant of it, but it shows up. People get sleep apnea. That is a sign of cardiovascular issues. And so these are one way. This is one way you do it. With Parkinson's disease, you can use actually, let me backtrack here, because actually, even before Apple came along, Samsung has been doing something similar for a while. If anyone had any of the Galaxy phones for the last few years, they had a built-in pulse reader, reads your pulse. And for a while they had a program. I want to say it was UC Davis, and it's still active now. I believe it was UC Davis and some other universities and health systems where they will monitor your blood pressure they will monitor your blood pressure in real time, and so we will be able to see that just using this pulse sensor on the phones. And so they've had that, and you will enroll into this program, and it will track your pulse and real time. And so they will be able to get a lot of data just based on just being able to do that. So they can see if you were active, what your heart rate was like, or if you weren't active, what your heart rate was like. Because again, we know that resting heart rates is different from an active heart rate. So if you're active, you're exercising, we know it's going to be higher versus if you're resting, it should be lower. So that's one way. The other way is also using it when you're thinking out. I was, when you're talking about diagnosing something like Parkinson's disease, and everyone is familiar with Muhammad Ali. That's what ultimately killed him, was having Parkinson's disease.
Michael J. Fox as well.
Yeah, Michael J. Fox, because one of the end stage of Parkinson's disease generally results in patients developing dementia.
Thank you for that, Dr. Phoenix. I put up the I shared my screen and about the World Economic Forum, digital health at a tipping point. I encourage you all to sit down and actually watch that in your spare time. We don't have time to go over it right now, but it's one of the main drivers as to why we created this hangout, because the stuff that they're talking about is where the market is going ultimately. So I'll give you a summary as because I've already watched it twice, but a summary of where this is going. You're gonna have to have dual majors, either a major and a minor, or just dual majors altogether. If you're gonna go into nursing, you may have to have computer science or data science as a minor or another major.
Actually, let me speak to that for a second. There are actually specific. We took IT classes. They were in my baccalaureate program. Again, we talked about this earlier in the last broadcast, but this is one of the major differences when you do a baccalaureate program in nursing versus doing an associate's. Actually, we did take IT classes and stuff like that, so that was part of our general education. I mean, it was it was very generalized courses, but if you decide to go to the graduate level, there are master's degrees in nursing that are specifically dedicated to informatics. And that's all you do. That's if you want to move away from the clinical side of things, you can get a master's in informatics. You can get a doctoral. They have nursing PhD programs that are dedicated to informatics and biomedical and health informatics. I mean, because again, this is one of the we are understanding that health systems every single day, every minute generate. We're talking terabytes of information. Well, actually, that's not even. There's actually a far larger.
No, it is terabytes. It is terabytes.
Okay.
Yeah.
Okay.
Especially if you're going to be doing genomic modeling.
Exactly.
You're talking up to 15 to 20 terabytes of data that needs to be stored in raw format.
Yeah. So again, this is not just something indicative of nursing. This is healthcare in general. And so, if anyone that sees, if you go into any hospital, you see you're in the ICU, you maybe might have had a family member or someone you knew, you might have visited an ICU. You see that they're hooked up to a ventilator, they're hooked up to an EKG, they're hooked up to a pulse ox. And if you go to the nurses station, you'll see all these monitors, and they're getting information in real time from these patients. So if the patient starts to cold, you immediately get an alarm. If their oxygen saturation drops below 90%, you're getting an alarm. So again, we can monitor all these things in real time. And so one of the major areas where IT is, where we're leveraging AI and deep learning and stuff like that is in the use of understanding, okay, if we looked at all these patients who for the last year or so, we looked at, just for example, their pulse and their heart and their blood pressure. We can start to see, okay, well, this is what happens at this time when this person started to crash. Or, maybe this person had some early warning signs that they were gonna go south that we just didn't pick up. So this is one way we call this, you guys know predictive analytics and stuff like that.
Okay. Go ahead, Gabe.
Oh no, nothing. I thought we were. No, it's cool.
No, I was actually just trying to give a summary of
Yeah.
the World Economic Forum event, and one of the things that caught my eyes or caught my ear was that they were talking about delivering healthcare as a service. So healthcare as a service, and one of the panel members talked about the shipping containers being customized, put on the back of trucks, and delivering it to villages in China, because China, they still have rural areas that are not being serviced at the same rate as urban centers. So how and a lot of, because of the one child per household policy, many of the children have left the seniors and elders to their own detriment. And what's happening here is no one's really there, so they have to retrain all of these millennials to be social workers and have these dual backgrounds in healthcare, and send them back out there into the villages to actually aid these people. But they had these shipping containers established and cut out because they have so many of them, and they put all of the most advanced digital health equipment into these containers, dropped them off into these villages, and now you have portable hospitals, which is something that hasn't been seen before. You got to watch the video to really understand what they were talking about. But the ability to utilize 5G, brother Dr. Phoenix was saying, your wearable devices collecting all of this data, machine learning, deep learning, reinforced learning models, as well as artificial intelligence, to actually create this new sort of digital health platform that's going to aid doctors in assisting your senior elderly people in your more impoverished areas. And one of the things that also caught my ear was that a lot of their doctors in their villages actually don't go to school to get their PhD. They actually been practicing medicine for so long from a holistic scale or holistic level that they leverage the environment for their medicine. So there's a lot of plants and things around that they utilize to actually take care of people in these rural areas. Dr. Phoenix, you have anything to add to that?
Yeah, so I will actually go back even further. When I was in the military, again, I talked briefly about me having a background as a medic. Typically, this is what military medicine is at. Is what it is. This is what you do. You have little camps, and I remember when I was in Iraq, we had camps set up. We had tents, little we had little tents that were set up, clinics, and we split the medical team into two. So we had one team that dealt specifically with medevacs, and then we had one clinical team. So if the medics brought in somebody from the field, we'll take them to the clinical team that was on the opposite end of that. And we had everything. We had mobile labs. We had access to. We had satellite based internet, stuff like this. And like I said, this is a little over 10 years ago. So I mean, these things have been practiced already, at least at the military level, and they're just making their way into healthcare at the civilian level. And one thing to keep in mind is that healthcare innovation moves kind of at a glacial pace in healthcare, and a major part of the reason is because, one, practitioners, specifically physicians, don't like to change. They've done things a certain way for such a long period of time that it becomes very difficult to get them to change, especially when you're dealing with some of the older physicians, for example. The younger folks like myself or other folks out here, they have, they're far more capable and far more interested in leveraging technology to one, reduce health disparities, to bring these mobile clinics, these mobile hospitals to people in rural areas. And that actually segues into another part of what got discussed in the video, which was about telemedicine and telehealth. Again, and I talked about this before, where you have companies. People want to make some money now. There's very little utilization of telemedicine, telehealth in the health sector. Very little. And right now, you're seeing exponential growth in that area. Why? Because, one, a lot of practitioners, nurse practitioners, PAs, physicians, they're using it to bolster their income. they typically don't do it full time, but they use telemedicine, telehealth to bolster their income. So you can do like 20, you can do your regular clinic hours, and then you can do another 20, 30 hours a week of just telemedicine where you're doing something similar to FaceTime, where you're doing video conferences. There's a good video you can go to on YouTube from CVS where they have their minute clinics, and
Yep.
they're all staffed, and they're ran, they specific, this is for nurse practitioners, they're all staffed and ran by nurse practitioners, and they actually have a whole telemedicine thing set up. And I'll try to find the video and put a link to it, but you can watch it where a nurse practitioner, she did like a throat exam on a patient that had strep throat, and she was on one end of the conference of the teleconference, and the patient was on the other end, and they had like a medical assistant or a regular RN that was there that was actually doing the exam, and they had a camera and stuff. And so the nurse practitioner, she can ask the nurse to stop or freeze those frames, and she can get a good look down the patient's throat. And so and again, she was in one location, and the patient and the nurse was in a completely different location, and they were able to do this in real time, and she was able to diagnose that patient in real time with strep throat. And this is something that they're using at the CVS minute clinics. And so again, just being able to make healthcare more accessible, but also cheaper. And again, this is the big issue with healthcare in this country, is that it's cost so much, but we tend to get very little benefit out of the price we pay for it.
Yeah, and it's actually very good points that you're making, because that's what was discussed in the video. Leveraging artificial intelligence from a chatbot perspective. So for those who don't understand what a chatbot is, basically a prompt pops up on your web browser asking you if you need assistance. You tell the chatbot what your problem is, and the chatbot responds through artificial intelligence based on the question and their knowledge base, and tries to bring you a answer based on what knowledge is available in some of the telemetry that has been developed in the background. So they've been able to get 90% efficiency out of this. So Dr. Phoenix talked about this before, that a lot of your Black men seldomly, or if not ever, go to the hospital for preventive medicine. And they develop conditions over time that doesn't, that where it's too late down the pike to actually assess. You end up with type 2 diabetes or type 1 or other cardiovascular issues that could have been prevented years in advance had they just taken the initiative to actually go see a doctor. And I think what we've talked about before was that the capitalization aspect has not allowed a lot of Black men to actually go seek better healthcare treatment. But now with digital health, we can deliver that as a service. In the same way you can order a pizza on your phone from Domino's Pizza, a Black person should actually be able to seek healthcare as a service through an app that can actually deliver, a roaming nurse or a field nurse or something to that effect to this person's house, so that they don't have to actually leave, and it can actually be more cost effective rather than to go to the ER and run up taxpayer money on a bill that's not necessary. Dr. Phoenix, you have anything to add to that?
No, you bring up a few very good points. I think that, just going on the last point you talked about, coming to the ER, we know for a fact that ERs are essentially being used as primary care clinics. We know this for a fact. Most of the people coming to ER do not have an emergent medical issue. Most of them are coming in because they don't have access to a primary care provider. And so, their diabetes is out of control. They can't control their blood sugars, or they have high blood pressure, can't control their high blood pressure. So we know for a fact in health systems that ERs, for example, are being utilized as primary care clinics, because and this is very specific to Black folks. Well, not to Black folks as a collective, but just to keep it at the Black folks, since this is a Black channel. But for Black people, we know that if you go to any hospital in Black areas, one, there's not many hospitals, especially where I'm at. that there's only one hospital that truly serves the Black people in the city I'm in. And yet, if they're not equipped to handle, very serious issues. They do a lot of birth, they do a lot of birth, they do a lot of deliveries of babies and stuff like that, and some other basic stuff. But when it comes to people who have more serious emergent issues, they typically have to ship them out. And so if you were a person, for example, you know you might have had a stroke, or you might be on the verge of having a stroke. One way that we'll show up and we can recognize that in the ER, but sometimes you can't deal with that where you're at, especially in many of these hospitals that are in Black areas where you don't have the personnel or you don't have the necessary equipment or expertise. So now you have to ship people halfway across the city, and in that time period people can die. And so what incorporating technology, AI, and stuff like that into the health sector, what it does is that it allows us to meet people where they're at. Okay. And specifically with Black men, because we know part of what happens with Black men, and studies show this, is that Black men typically do not respond well to non-Black providers. This is true of Black people as a whole, but specifically Black men do not respond well to non-Black providers. And a lot of research suggests that Black men will respond best to other Black males who are providers. And so what happens in this regard, what I was just talking about with like the CVS Minute Clinic, and I put the link in the chat. So it's like a 3-minute or so video, but you can go check it out and kind of see what they do in real time using telemedicine. And so with Black men, what we're seeing, what technology could potentially do is that it can allow us to have not necessarily a face-to-face, but you can have a video conference in privacy. Because a lot of brothers, they won't, brothers as a whole, they typically won't get up and they won't just talk about their issues outright. You kind of have to have a pretty deep conversation with brothers, and it'll kind of come out gradually. So what technology will do, in the example of telemedicine, is that you can have those very private one-on-one conversations, and you get to really get an idea of what's going on with brothers. Because again, I talked about how I do get brothers that come to me offline. They come to me in private and they talk to me about their health issues, and so I deal with it there. But again, there are many things that happens with brothers, for example, where they need to see specialists, or they need something above what I can do for them at the time.
Gabe, you have anything you want to add to this?
Nah, I don't have anything to add. It's a bit verbose, so it's kind of hard to find areas of intersection.
Well, actually, I was about to go into that.
No, I just want to get to the next item on the docket. So it says, what are the academic factors of digital health? So academic factors, where can you go to actually get involved in digital health from an academy perspective? I recommend EDX. Let me share my screen. I've added some items to the docket that I think would be relevant as a shortcut. I know there are no shortcuts in this field, but I do think it's relevant to actually get into some of these programs online that are either free or very minimal in cost. So on EDX, the first item on the docket is biospecimen research methods. This class is 6 weeks, 4 to 5 hours per week. It's a professional type, and it's from the University of British Columbia, which is an accredited institution, and the cost is $99. That's less than the pair of Jordans that everyone seems to love so much. So let me just read this off real quick. This biology and life sciences course will enable you to collect, recognize, and utilize a quality human biospecimen. The success of your research depends on the quality of the biospecimens you use. Get ahead of the competition, increase your chances of being published in high-impact journals, and open doors to opportunities for working in leading biomedical research laboratories and biobanks. Over 6 weeks, professionals will, with extensive experience in biobanking, will from the University of British Columbia and the BC Cancer will teach you the international best practices for biobanking and research involving human biospecimens based on National Cancer Institute (NCI) and International Society of Biological Environmental Repositories standards. What you'll learn is develop the knowledge to better collect and process human biospecimens to enhance research credibility, how to plan a successful research study using biospecimens, how to properly store and manage biospecimen data, understand the ethical and privacy issues related to biobanking, gain applicable hands-on techniques related to informed consent, data management, biospecimen collection, and storage. Looking at the syllabus, we call it. So it's 6 weeks. The first week is overview. Second week is biospecimen collecting. Third week is biospecimen storage. Fourth week is data systems and record management. Fifth is ethics, privacy, and informed consent. And then the sixth week is final exam.
There seems to be some hands-on experience that's necessary for this particular type of work. How do you get that from
quite.
on? Well, it says something about at the end. It said gain practical experience with biospecimens in the laboratory.
Yeah, I think there's more like something like what Mike just read off. This was, if for example, let's just kind of bring this down a little notch, kind of not keep it sort of at my level, but let's just bring this down to practical everyday usage. How brothers can get involved. All the stuff that Mike named in these over the course of was that 5 or 6 weeks, I think that was for that course. These are things that nurses do every single day. You collect biospecimens. I mean, blood biospecimens, everything from blood, urine, whatever. You're doing that every single day as a nurse. So all those things, that the ethics and all that, the design, these are all things you learn as a nurse. So again, if
I know you're talking about nursing. Yeah, you're talking about nursing, but I'm saying like if someone's coming,
No, I was going to get to that because one of the things that he talked about was about security and stuff like that. Understand something, in the healthcare sector, security is a major issue. And for brothers like Mike and yourself, Gabe, you guys can come in because simply you guys have a background in cybersecurity. Many healthcare systems don't have folks who are specifically skilled in cybersecurity to help them to keep their network secure. Healthcare networks are a treasure trove of information if they ever get hacked. You know everything about everybody. So for brothers like yourselves who are involved in cybersecurity, you have a good opportunity where you can get in just by on the expertise of you being in cybersecurity. Because one, we understand that cybersecurity is kind of something newer within the realm of IT and stuff like that. It's not something that's been pushed up until maybe about a decade or two ago. So it's still relatively new as a whole, especially in the arena of healthcare.
Yeah.
So and somebody, the brother Motown, he put up and thing. The VA is a prime example of it. The VA uses some of the oldest tech. They're the least they're the largest health system in the country, but it's the least modernized health system in the country. And believe it or not, the VA employs the most nurses in the country, and they also provide the most residencies for physicians in the country.
Mm-hmm. Yeah, I read an article about VA CISOs, Chief Information Security Officers, being leaving every year or a year and a half because the system is so antiquated. And there's so much pushback on moving on to new emerging technology that it has made it difficult for Chief Information Officers and Chief Information Security Officers to stick around a long time. So I guess what you're saying must be very true.
Yeah, again, like for brothers like yourselves, I mean, there's tons of work for you guys. I mean, like I said, you guys have been, I heard Gabe when he did his interview over at O'Shea Duke Jackson's channel, he's been doing it for a while. You obviously been doing it for a while, Mike. So you guys come in with a level of expertise that you typically do not see within health systems, because again, when we think of security in health systems, we're kind of thinking about HIPAA, and really that really only applies to folks on the clinical side, making sure that you're not doing some of the basic stuff like posting people's information on Facebook and Instagram and stuff like that. Or if you're in spaces like this, making sure you're not giving out personal details of patients and stuff stuff like that. I mean, typically that's what we think of security within the health system. But for brothers like yourselves who are skilled in the areas of cybersecurity, I mean, the field is wide open for you all. I mean, you can look at any of the. I mean, they have. I mean, they're all over the place. So I mean,
Let me get to this. Let me get to this next item on the docket. So I added this one as well. This one is from Harvard University on EDX, and it's called genomic data analysis. And it says what you'll learn is advanced techniques to analyze genomic data, how to structure, annotate, normalize, and interpret genomic genome scale and I don't even know how you pronounce that. I don't know if that's spelled correctly. I guess assays. How to bridge diverse genomic assay and annotation structures to data analysis and research presentations via innovative approaches to computing. How to analyze data from several experimental protocols using open source software, including R and Bioconductor. Dr. Phoenix has mentioned R before, but let me just read this off real quick. So it's a three graduate level classes: introduction to bioconductor, annotation and analysis of genomes and genomic analysis assays, high performance computing and reproducible genomics, and case study in functional genomics. So this is $132, 4 to 6 months of completion time, and is no other requirements to actually get into this class. It's from Harvard. I'm throwing this in there because it was mentioned during the World Economic Forum, some of the areas of crossover that's going to happen in digital health. So physical health specialists, as well as biological healthcare specialists, as well as information technology people. Or information technology skills are going to be needed in those areas.
Mm-hmm.
Let me throw this up.
I'm sorry, brother. I didn't mean to cut you off. Go ahead. Sorry.
Yeah, let me just finish these items on the docket real quick. All right, this next one is from EDX as well. This one is from IBM, Professional Certificate in Python Data Science. What you'll learn: understand Python language basics and apply to data science. Practice iterative data science using Jupyter notebooks on IBM Cloud. Analyze data using Python libraries like Pandas and NumPy. Create stunning data visualizations with Matplot, Folium, and Seaborn. Build machine learning models using Skippy and not sure what that says. Oh, Scikit-learn. Demonstrate proficiency in solving real-life data science problems. So again, this is 5 graduate level courses. It's self-paced. You process at your own speed. 22 to 4 months of time. That's up to 99 hours of effort. And it's $229 for the program.
It seems to be heavily.
Oh, go ahead. Gabe, go ahead.
No, I was going to say it seems that a lot of these particular programs are definitely focused on data ingestion, data science, data analysis. I know that Elastic, right? The Elastic Stack has a heavy focus on that too. So it seems to be a pretty competitive, or a lot of different platforms that kind of really get into big data and data science and data analytics in multiple fields, because it's pretty much, because I remember I was on a project. Well, actually, I was pretty much just trying to build out a particular program at my last job with log analysis, not only log ingestion, but even parsing the data, be able to feed that data into a SIM, SIM standing for Security Incident and Event Manager type of software, and being able to really just tell what type of events and configure the SIM to be able to tell what type of events are actually happening on the network. And I was working on building that out with the Elastic Stack, or ELK stack. So Yes, but like they mentioned, like Python is really good for this. Flying through data and being able to pull out particular attributes or being able to parse data, and R also within that same field. So it seems to be a lot of different platforms for accomplishing a lot of the same type of things in data analytics, at least from what I've seen. Hello?
I'm sorry, I was actually talking and I was muted. Sorry.
Oh.
I would say you would actually be right about that, but I actually know the architect at Elk, at Elasticsearch, and was there last week with at an event with him. Used to be my director of operations, or director of security. So I was kind of familiar with what you were saying. But let me jump to this next one. This one is from Georgia Tech. So health informatics on FHIR. Let me explain this out. This series of courses begins with an introduction to the U.S. healthcare delivery system, its many systemic challenges, and the prior efforts to develop and deploy informatics tools to help overcome those problems. It goes on to discuss health informatics from an historical perspective, its current state, and its likely future state. Now that electronic health record systems are widely deployed, the HL7 fast healthcare interoperability resources standard is being rapidly accepted as a means to access and share the data stored in those systems, and analytics is increasingly being used to support clinical research using the aggregated data. It then turns to the impact of FAIR in transforming healthcare with a focus on some of the important evolving areas of informatics, including health information exchange, population health, public health, M-health, mobile health, and big data and analytics. Use cases and case studies are used in all these discussions to help students connect the technologies to real-world challenges. What you'll learn, the unique challenges of healthcare delivery in the U.S. and developed world. The potential of informatics-based tools and systems to help solve these challenges. The impediments that have long existed to informatics adoption. The potential impact, technical details, and current adoption of HL7's new FAIR API is including specific examples of its use for physicians and their patients, population and public health and research. So there's 3 programs that go with this: health informatics, a current and historical perspective, data interoperability standards, and health informatics, the cutting edge. It looks like they've already started, but they're self-paced. 5 weeks per course, 3 to 4 hours per week, and it's $267. Dr. Phoenix, you have anything you want to add to this?
Again, I mean, what Gabe talked about is very true, because this goes back to what I said earlier about the amount of data that's being generated from health systems. They're sitting on tons of data and no one knows what to do with it. So, I mean, if you're someone who interested in going down the data science route, learning about Python, Python R and all that stuff, you would be in a prime position to leverage those skills in that. I can tell you right now, and I put up a link to a video from the National Institute of Nursing Research, and the woman, she gives a 1 hour presentation to the NINR on big data. They have a big data boot camp, and this is across the board. So NINR is one of the schools of the NIH. And in fact, if you go to the National Institute Human Genome, that's also part of NIH. They also have a series of lectures about big data and data scientists and stuff like that, because these health systems are in dire need of data scientists to do the work, to be able to parse the data and figure out what's going on with all this data that's being generated. So again, to go to what Gabe was saying, he is very correct in that a lot of it is being built around your ability to be able to tabulate and organize, large data sets. And so again, for folks who are interested in these fields, who have skills in Python and such like that, you will be in a prime position to leverage your skill set in the healthcare field.
Yeah, the last one on the docket, or I should say the last item in this section would be artificial intelligence. They mentioned artificial intelligence being one of the primary drivers of digital health. So, learn the fundamentals of artificial intelligence and apply them. Design intelligent agents to solve real-world problems, including search, games, machine learning, logic, and constraint satisfaction problems. This is from Columbia University. What do self-driving cars, face recognition, web search, industrial robots, missile guidance, and tumor detection have in common? They are all complex real-world problems being solved with applications of intelligence, AI. The course will provide a broad understanding of basic techniques for building intelligent computer systems and understanding of how AI is applied to problems. You will learn about the history of AI, intelligent agents, and state space problem representations, uninformed and heuristic search, game playing, logical agents, and constraint satisfaction problems. Hands-on experience will be gained by building a basic search agent. Adversarial search will be explored through the creation of a game, and an introduction to machine learning includes work on linear regression. So introduction to artificial intelligence, building intelligent agents, machine learning algorithms, applications of AI, natural language processing, robotics, and vision, solving real AI problems through programming with Python. This is a 12-week course, so it has every week there's going to be something new. Introduction to AI, intelligent agents, everything is broken down and structured. It's 12 weeks in length, 8 to 10 hours per week of effort. And it's free. If you want a verified certificate, it's $325. Let me see the prerequisites. So you just need some basics of Python programming, but you don't need to be an expert. You should be able to get through this with some little bit of study time. It starts September 19th, 2019, so you have some time to actually think this over. So what are the salaries for digital health people? Typical salaries that I've seen and range on Indeed is anywhere between $80,000 to $150,000 a year, regardless of what region you're in, whether you're in the Midwest or you're on the left coast or on the East Coast. The ranges are pretty much all the same.
You said for digital, what were those titles? Digital healthcare roles? Like, what are the titles that someone would search on Indeed?
So if you just let me share my screen.
Mm-hmm.
What the hell's going on, man?
You're not able to share?
No, I mean I am, but my taskbar crashed on me for whatever reason. All right, so most of the stuff is data scientists.
Like a healthcare data scientist would be something that somebody would search.
Right, so healthcare data scientists or data architect, data engineering. Those little those titles will lead you into that same digital health market, which is what they were talking about at the World Economic Forum. Information architects, information engineers, information scientists, regulatory compliance as well falls into that. We have I work in the life sciences sector myself, cancer drug research. So I do cybersecurity in that area, and I can tell you, surrounded by lots of people on the same floor who are involved in these areas, and they make a considerable amount of money doing this.
Is that like HIPAA related as it concerns whatever regulatory guidance you guys are following, or do you follow something else?
No, it would be it would be quite a few other things. But HIPAA would be just partial, just for data.
So some of the NIST framework too, or
yeah, there's a couple of NIST frameworks. 800-53 is something that we would follow from an IT perspective, but from a healthcare
for federal environments.
For federal environments, we'd be following a couple other regulatory frameworks.
Okay.
Go ahead, Dr. Phoenix.
No, I was just gonna say, no, everything you said is absolutely true. And across the board, you're seeing this being, you're seeing health informatics, health IT, tech, it's being applied across the board to all fields within healthcare, not just folks who are on the who treat people, your physicians, your nurses, and PAs and such. But this also applies very heavily in the pharmaceutical industry. You're seeing this now because what you're seeing now is that, and for example, for pharmacists, many of them are moving away because part of it is that you have a high saturation of pharmacists. In the market has a pretty high saturation, so many of them aren't even getting jobs. It's taking them a while to find jobs, and you having those who are moving away from sort of the clinical pharmacy over into pharmacy informatics. And I can tell you for a fact that I know specifically these jobs are paying like 150 plus. So, I mean, these are all things to do. But again, this is one avenue of entry. There's a number of different ways you can get into this field, but for folks like myself who are in healthcare as, clinicians and stuff like that, we have sort of a very distinct pathway, if you will, versus brothers like, yourself, Mike and Gabe, where you guys are coming from an engineering and tech and computer science tech background, where you guys are you're understanding exactly how to build out these networks and such like that. Mm-hmm. So if you're someone that has a technical background, you're ripe for this environment, especially if you can do anything within a realm of 3D modeling and stuff like that. If you can do stuff in that, you're especially, Mike was just talking about he does cybersecurity with cancer researchers. I mean, this is a major area where you're seeing 3D modeling really, really just exploding. And so again, if you're brothers that are skilled in these areas, I mean, there's pretty much not. I mean, it's just a wide open field for you, no matter where you're coming into this field at. Period.
Hey, Mike, do you primarily work in like securing the data of the cancer researchers, or I guess what's involved in some of the work that you do?
We secure infrastructure first and data second.
Mm-hmm.
We secure the cloud.
Okay.
So we have instances, dozens, if not hundreds of instances in the cloud, used for building artificial intelligence models, as well as machine learning models. Quite a few other areas of research that they do, leveraging AWS, leveraging Azure, leveraging quite a few computing power and storage. So that aspect, and then you have the endpoint aspect of just managing the whole entire organization, making sure that data doesn't get lost, right? So DLP, data loss prevention.
Mm-hmm.
I have a quick question though. You guys, any of you guys do anything with Google Cloud or just cloud computing in general?
Yeah, I don't particularly.
Yeah. The reason I asked that because I know I know, and I'll try to put the link to this video, but I do know for a fact that Google has partnered with the NIH to help develop and help roll out cloud computing for the NIH and all the various institutes associated with the NIH. Because again, like I said before, part of what's happening is that you have just so much information that needs to be managed, and again, healthcare systems and researchers alone don't have the capability as a whole. So you're seeing all these collaborations between all these different entities within various industries. So again, this is a major area where you don't have to be a clinician, you don't need to be a physician or a nurse or anything like that to get involved. But if you have expertise in any of these areas, cloud computing, cybersecurity, you're in a prime position to take advantage of the fact that much of this stuff is not really being utilized within the health system as a whole.
Mm. I would even say, and Mike, you can speak to this too, that a lot of the same security measures that you will implement or defensive measures that you will implement for a cloud environment are very similar to that of like a web application or a web server, right? They use a lot of the same communication protocols, right? TCP, port 443 for HTTPS, and port 80, right? TCP port 80. So those are a lot of the same. So the threat vectors involved with a lot of cloud computing. It's very similar to that of a web environment, a web application, or a website environment. Have you had that same experience, or have you noticed some additional defenses that are necessary for securing the cloud environment?
Yeah, so anything that's going to be involved in this 800-73, I think that might be for cloud computing. We're definitely following that. But what happens is you get a lot of drive-bys, malware drive-bys. So yeah, you secured 80, you secured 443. But what happened when user goes to on their lunch break, they decide to go watch some gossip site,
Sure. Click on something.
Has some malware drive-by through the browser, or 80%, if not 90% of our attack vector is through spear phishing and whale phishing.
So you bypass whatever defenses are there. Also, the firewall, if you have any type of firewall that's there, it bypasses that. Sure.
Right. So yeah.
So then do you result to segregation, right? Segregating the different assets in your network. Is that another defensive measure that you guys look at?
Sorry. Say that one more time.
Segregation. So even if the attacker gets right, or if the worm or the malware gets past the user, right, and the user is good on the network, right, they have something on their machine through a spear phishing attack, or just like you said, drive-by malware. Are other defensive measures that you guys implement in, in your particular environment, like segregating networks, segregating devices where certain things can't talk to other things, so the spreading is slowed down?
So we have IPS on every endpoint, and we also
IPS.
Intrusion protection on the endpoint.
Oh, gotcha.
Right. So and you also look at malware hashes. So I'm actively threat hunting via malware hashes to see if anything pops up on any endpoint that's in the environment.
Yeah.
9 times out of 10, we can spot malware hashes on the radar that are being implemented on a machine, whether it's spear phishing or some form of malicious application, or potentially unwanted application, which is a gray list application. May be safe, but we have to trust first but verify, right? So we're seeing a lot more of that. And your traditional firewall brute force attacks, man, those things are failing and kind of antiquated in terms of an attack vector. So for us in the healthcare industry, data security is more important than anything else. If we don't have high availability of data, we're SOL, right? And as well as connecting with third-party vendors, right? So vendor risk assessments, it becomes very important.
Remote connections and all that. Yeah. Fun
Absolutely. Absolutely. You know, you're connecting back and forth with these vendors. You don't know what's in their environment. Yeah, you gave them a questionnaire, but you don't know how they manage their systems and then infrastructure, right? So if they're compromised and you're connecting to it, then we're just as contaminated.
Absolutely.
So that's the cybersecurity aspect to digital health. All of this data being moved around in healthcare, being generated. Well, there's something called PHI in EMRs, electronic medical records, right? Your PHI, protected
Personal
health. The protected health information has to be secured. If you look at HIPAA and you look at some of the guidelines, once that data leaves your environment, that data has to be de-identified. So if it leaves the environment and it has PII attached to it, you just violated HIPAA's guidelines. So now you're really under the knife now, especially in places like Massachusetts that has MDPR, which is Massachusetts Data Protection Regulation, similar to Europe. Every record that is lost is $50,000 a record. If you lose 143 million records or 100 million records, you are out of business, and you will be finding another job somewhere in another country, maybe not in this country.
Yep. And that even contributes to kind of how you were speaking of before, that high turnover CISO roles, right? These chief information security officers are individuals who are responsible for pretty much protecting whole organizations. What I've heard a lot, you know, in the whispers, not even necessarily the whispers, if you get breached, your CISO is pretty much gone, right? Definitely it depends upon the level of breach or the level of intrusion, but it's pretty much you got hacked on that CISO's time. So that really looks bad. So a lot of times the turnover is heavy for those particular roles.
It's also a matter of internal politics as well, right?
Indeed.
So you may have not even gone through a breach or been compromised, but you have your own vision as a CISO as to which way you want the company to go, and you get a lot of pushback because you don't get a lot of buy-in from the C level, right?
Yep.
So that becomes an issue in itself, and for a lot of guys who or a lot of people who get into a CISO's role, yeah, you like being in a leadership role, yeah, you have these great visions as to where you're going to be, where you want the company, the organization to go in terms of from a security perspective. You manage all things security, and you kind of guide the organization as to where you think they should be going security wise. But what happens here is security doesn't have a whole large budget. They have to share their budget with IT.
Yep.
IT eats up a lot of their budget because they're purchasing servers and other services and so on and so forth. Well, if you only have a $10 million budget and you spent $9 million on hardware and accessories and other services, well, guess what? That $1 million that's for security, that's not enough.
Mm-hmm.
You know, if you're
salaries.
trying to buy, well, beyond the salaries, right? So the salaries might fall under a different scope, but from a security standpoint, and you only have $1 million budget, well, guess what? That Splunk contract is probably going to be $700,000 right out the gate.
Mm-hmm.
You're left with $300,000.
Right.
Right. So then you might have to spend another $100,000 on DLP. You might have to spend another $100,000 on email protection. Right.
Yeah. So a lot of different environments, a lot of organizations are looking for more of those integrated systems, right? That have, like you said, like DLP, intrusion protection system, dashboards. I mean, you name it, all in a unified platform rather than kind of piecewising everything together. Because if you buy a lot of different pieces, you have to in some way have these things talk to one another, and you have to have expertise internally, or you can contract somebody to configure everything for you. So yeah, these unified systems is definitely one of the areas that a lot of security organizations or organizations in general are looking for.
Mm-hmm. Yep. So that's where cybersecurity comes into digital healthcare, or digital health, because the generating of data and the guidelines and some of the regulatory standards means that data that's being generated through telehealth and telemedicine and so on and so forth, you can't lose that patient's data. So what do you do with it? How do you de-identify data that leaves your environment and goes somewhere else? You also have GDPR, General Data Protection Regulation, out in Europe and the EU.
Yeah.
One of the stipulations is that if a user requires or requests that their data be deleted, you have to delete it from everywhere from every data endpoint that it is touched. That's really difficult.
Yeah.
We haven't gotten to that point in the
A
United
lot of
States yet.
artifacts. Yeah.
Yeah, we haven't gotten to that point in the United States yet, but in the next year and a half, maybe by 2022, we will have to comply with such regulations. I believe California is working on their own CDPR. I know New York has their own data regulation, and New Jersey has it. Massachusetts was the first one to have it. And when TGX got breached, that was a big problem for them. I don't know how they worked their way out of that, but we also have to understand the difference between the compromise and ransomware, right?
Yeah, that's very big in healthcare, right? Yep.
Right. So ransomware means that data is still there, but it has been locked away from an availability standpoint from the organization. So the data exists, it's just not in their possession anymore. Now, how they go about it, whether they pay it off like those guys in Florida did last week, or Atlanta, the city of Atlanta was compromised last year.
Yep.
They were offline for quite some time.
Internationally, they've been paying.
Yep, we saw what happened in Baltimore a few months ago, or I think it was Maryland. They were compromised with ransomware. So
yeah, WannaCry is running rampant in a lot of different organizations. But yeah, go ahead.
Yeah, ransomware is deadly to an organization because your data is there, but it's not available.
Yep.
A compromise, you may have had, let's say, you may have been compromised on your mailing list, right? So
email server,
not even just the email server, right? So maybe a distribution list of, what do you call that? It may have just been some people signing up for email to receive monthly newsletters.
Okay.
Right. That may have been something simple, as benign as it is. It's been compromised. You still have to report it. Did you lose the data or did you not lose the data? Was any of that data even? What was the importance of the data? What was the risk appetite that your organization had for that? Those are questions that need to be asked in terms of digital health, because a lot of this data is just moving around in free space. There's no real storage facilities or data centers like you would have in the legacy organizations that rely on data centers being in-house. Everyone wants to move their things to the cloud because they're under the impression that the cloud is safe. The cloud is a nice buzzword, right? Cloud, cybersecurity, all of these little buzzwords, blockchain, AI. They love these buzzwords, but they don't really understand it. And when it comes to digital health, you start losing people's information, no matter how poor that person is or how impoverished that neighborhood is. That's still a loss of data that has to be secured.
Yeah, I'm not sure if you dabble on like the dark net, the dark web, like with Tor browsers or anything. But this information is valuable. I mean, you get several records of people's personal information that sells for a good amount, right? And I think that is another thing, right? That's a motivator of the adversaries. It's because it's a dollar amount associated with people's personal information, and overall, to keep those things secure is keeping people secure, and it's also working against, I guess, the dark web or dark markets that exist for selling people's personal information. So
yeah, and hospital records, medical records are very lucrative on the market because they don't change. They have to remain the same. If you know, if a healthcare organization loses data, such as PHI, you're, it's impossible to come back from that, because it's so valuable, right? You can't do business if there's no, the PHI has been breached, right? So
Yep.
what you have here is organizations that have not cleansed the data and don't really understand what to do with the data.
Mm-hmm.
Once the data leaves Detroit, and you're an insurance company in Blue Cross in another state, well, guess what happens to that data? It's going over the wire.
Mm-hmm.
Okay, did you encrypt it? Was there encryption in transit? Was there data encryption at rest? Was there or were there any mechanisms in place in terms of declassifying that data as it left the environment and went to the next destination? What are they doing to reclassify that data? How are they managing that data? You don't know, because you haven't interviewed those people. You don't work in that environment.
Mm-hmm.
Digital health is an emerging state of technology in industry, but there's still a lot of um, unanswered questions as to what happens to the data, because data is the most important aspect. Yeah, you have an Apple Watch that generated all of this EKG data, and then it gets sent off to the doctor. How do we know what happened to that data in transit? It's not uncommon that a guy with Wireshark and a laptop sitting outside did not intercept that data that was passing through there with an SDR, with a software-defined radio. You know, a Raspberry Pi for $30 and a nice Python developers kit would actually help them sniff all that data out and compromise it.
Mm-hmm.
So these are the important aspects of cybersecurity in digital health. Gabe, you have anything you want to close up with?
Nothing in particular, because I'm not in the healthcare for cybersecurity. I'm primarily in what you call like industrial control systems.
Okay.
So I focused on more of those systems like utilities, nuclear plants, government facilities, kind of like very large. Yeah, I work for FireEye. Yeah, Mandiant FireEye as a consultant. So yeah, we get heavily into intel or kind of more categorizing our adversaries with our APT, like advanced persistent threats and all those particular things. But a lot of them do have the same health. Really, many of the cybersecurity fields have a lot of a lot of intersecting topics. So yeah, this is definitely, although data security isn't our heaviest, I guess, consideration. Say, for instance, in an electrical utility, right? A plant, what you're looking at primarily. Yep. Yeah, we've been spreading this article for a while now, and we even spoke about like internally to the organization. But yeah, anyway, our heaviest consideration is availability of service, and not necessarily uh security of service. I mean, security of data, because data can be lost as long as the plant continuously runs. That's the most important thing in a particular field that I'm in cybersecurity. But yeah.
High availability.
Yep.
Yeah, so I just want to read a quick caption from this article. This one is from Forbes.com. U.S. government makes surprise move to secure power grid from cyber attacks. This is what Gabe was talking about. The U.S. government has announced a surprising move to secure power grids by using retro technologies. It comes after numerous attempts by foreign actors to launch cyber attacks on so-called critical national infrastructure. Nations have been trying to secure the industrial control system that power CNI for years. The challenge lies in the fact that these systems were not built with security in mind, because they were not originally meant to be connected to the internet. It is with this in mind that the U.S. has responded with a new strategy. Rather than bringing in new technology and skills, it will use analog and manual technology to isolate the grid's most important control system. This, the government says, will limit reach of catastrophic outage. This approach seeks to thwart even the most sophisticated cyber adversaries who, if they are intent on accessing the grid, would have to actually physically touch the equipment, thereby making cyber attacks much more difficult. said a press release at the Securing Energy Infrastructure Act, SCIA, passed the Senate floor. When
Yep.
introducing the bill in 2016, U.S. Senators Angus King and Jim Risch said specifically it will examine ways to replace automated systems with low-tech redundancy like manual procedures controlled by human operators. So this is the area that Gabe was speaking to, if this is the industry that he kind of works in.
Oh, I definitely work in this industry. Yeah.
Yeah.
Yep. Because there's so many different ways. So one of the biggest ones that we focus on in many industrial control system environments is that of what you call like air gapping systems. So you have a lot of systems, plant networks, plant devices that are not accessible to the internet, right? These things are not cloud, like there's no cloud, or I mean, it's even as antiquated as like no Active Directory, even though there are Windows systems in an environment. But these things don't talk outwardly, and they're neither networked together. So there are, and a lot of times it's the industrial control system environment is separated from the corporate environment, the corporate IT environment, by what you call like a data diode or a unidirectional gateway, where data can not leave the control network and go to anywhere corporate. So corporate IT information cannot go down to like plant devices like actuators or motors or substations. So those are some of the defensive mechanisms, but they're even like they were saying, the government is even looking more to make it go back to analog, like not even go digital, you know? So it's a lot of different conversation in this environment.
Yeah, this next one is from Forbes as well. Urgent cyber warning for hospitals over threat of WannaCry repeat.
It's a resurgence of it right now, yeah.
Yep. In the 2 years since the devastating WannaCry cyber attack hit worldwide, institutions have not done enough to protect themselves against a repeat, and that's especially true in the healthcare sector. A report this week by Imperial College London's Institute of Global Health Innovation warns that hospitals remain vulnerable to cyber attack and must take urgent steps to defend against threats which could risk the safety of patients. So when they talk about risking the safety of patients, they're talking about not knocking off some of these IoT devices in the workplace through WannaCry. So if you could take healthcare offline and you could take the IoT devices offline, you know, Dr. Phoenix mentioned it earlier about EKG machines and insulin pumping machines and things like that that are connected to the network. They sound good on paper and seem very efficient, but if they can be knocked off, man, that's a big problem for you. In the UK, the finance cost of WannaCry to the country's National Health Service has been estimated at more than $100 million. The disruption to the patient treatment carried even more serious risks, with thousands of appointments changed or canceled as employees found themselves locked out of their key computer systems, reverting to manual paper-based processes. The report's findings are bleak to read, made worse because of so much of the defense is relatively straightforward. Outdated equipment, unpatched software, a lack of skills, training, and awareness. Last year, Redscan, a provider of threat detection and response services in the UK, conducted research into cyber preparedness in the health sector. The company found that, on average, hospitals trust employ just one qualified security professional per 2,582 employees, with nearly a quarter of trusts having no employees with security qualifications, despite some employing as many as 16,000 full and part-time personnel. The research also exposed several organizations that employ no qualified cybersecurity professionals, with spending on training varying significantly between trusts from 238 pounds to 78,000 pounds. Radscan, director of Cybersecurity, Mark Nichols, described the lack of investment in training as alarming. Since the WannaCry attack in 2017, cautioned Dr. Gafford, lead author of the IGHI report, awareness of cybersecurity risk has significantly increased. However, we still need further initiatives in awareness and improve cybersecurity hygiene to counteract the clear and present danger these incidents represent. The WannaCry ransomware attack, which has been blamed on North Korean group Lock Computers, demanding around $300 per employee account. The IGHI report recommends that cybersecurity professionals are much needed within the public health sector, given the very material risk of a cyber failure, with inevitably more investment urgently needed. The increasing use of AI, artificial intelligence, and more advanced analytics and connected technologies exacerbate the risk, even as defenses fail to keep pace. A week ago, I reported that the U.S. Food and Drug Administration, FDA, had issued a warning over connected medical devices that are also open to a hacking risk. Again, the very real risk to patients was highlighted. In a statement, Lord Darcy, the IGHI's co-director, said, as we become increasingly reliant on technology in healthcare, we must address the emerging challenges that arise in parallel. This report highlights weaknesses that compromise patient safety and the integrity of health systems. So we are calling for greater investment in research to learn how we can better mitigate against looming threats of cyber attacks.
That's what we all say. That's what every C-level executive that gets breached or has some type of issue, they all say the same thing. I think one issue that I know, I mean, even from speaking to peers, healthcare doesn't pay what other fields pay as it concerns cybersecurity talent. And that's been a major issue. Like healthcare, automotive, unless you're really high up there. So at least that's what I heard through the grapevine.
Yeah, healthcare is usually the budget is usually tied up with doctors and nurses. So we have to pay Dr. Phoenix first before we can actually secure anything.
Yeah.
Well, that's changing now because the current models just aren't sustainable. So. So that's why you see this explosion of tech and AI within the industry, because the current models just are not sustainable.
Yeah, antiquated. Yeah.
Yeah. Let me read this next article. I don't know why it's doing this. Surveys. All right, that article is not going to be there. Actually, I got an idea. Let me see. All right, let me see here. Share my screen. All right, this one is from IT Pro Today. At the AWS Security Conference, experts address cloud concerns. So, again, the digital health revolves around cloud computing. Let's this out. It wasn't that long ago when the prevailing attitude towards security was that while it was important, it slowed down the processes of launching an application or bringing a product to market. Too often, security was tacked on at the end of a product launch, which created roadblocks for developers. Today, security is too important to be an an afterthought, and people working in security are promoting this message at events like the recent AWS Security Conference. Liberty Mutual Senior Director, Global Cyber Risk Management, Brian Riley, recalled 7 or 8 years ago when he would give presentations to the C-suite and his audience's eyes would glaze over at the mention of security. As soon as security would come up, out came the Blackberries, he said in an interview at AWS Reinforce in Boston, the inaugural AWS Security Conference. The last couple of years, there's been a drumbeat in the process of security issues that have affected various organizations, and there's much greater focus on security at the executive management level and at a board level. That increased focus in the C-level was evident at last month's Reinforce conference. While many sessions provide deep dives into specific security features and tools from AWS, there were just as many focused on broader security trends, breaking down silos between security professionals and developers. Historically, as a software developer back on Wall Street, I would produce a software package, put it onto a tape together with printed out installation instructions, and hand it to someone who would take it to a room. I wasn't allowed to go in to install it, Riley said. Now we can actually implement those security controls more effectively if we partner with the teams that are building those pipelines and build those controls through automation. So that we can execute them at a scale that we're simply not going to be able to with staff in a security organization. Bill Shin, Senior Principal Engineer in the Office of the CISO for Amazon Web Services, said that as the consumption of security has changed from companies sinking millions of dollars into capital expenditures investments to pay-as-you-go models, the industry has been able to embrace a faster pace of handling security threats. I think the security teams have to go faster, and they have to be the fastest thing in the organization. Shin said in an interview at Reinforce, holding on to a data center mindset when it comes to architecting the security in the cloud will hold organizations back from embracing its full potential, he said. This is the pipe dream in the security world. Going fast is
yeah. I was just yeah. I'm sorry. No. You go ahead. I'll follow that.
Yeah, the idea that you're going to go at breakneck speed in security is it's a pipe dream. There's these fantasies that some of these executives have about how you can go about improving efficiency and security. Well, you have to hire more people. If anything, I mean,
Yes.
One guy can only do so much. It doesn't matter how fast he goes; he can only do so much.
Yes.
Go ahead.
And it's like, and what is going faster? How do you quantify that? What does that mean? What does that really mean for your organization? Does that mean staying ahead of the adversary? Because unless you have internal pen tests, red team engagements, consultants coming in to evaluate your networks, do threat modeling. I mean, producing, as you said earlier, a risk appetite. You're not all ever going to be 100% secure from anything, but it's like, how do you mitigate your different risk? How do you deal with the risk that you have? So going faster is not the answer. You need a security organizational transformation in the way that you evaluate your whole program.
Mm-hmm.
And in training, right, for internal resources, internal people need to be abreast of what's currently happening within the industry in order for them to adequately secure against the current threats out there. You can't just say, we got to be better, bigger, and faster. You're like, how do you really assess that? How do you assess
you can't.
that?
Yeah, in security, there's no such thing as a LeBron James.
Nah.
So it's a pipe dream. You got to first understand the social engineering aspect and how to train employees on how to deal with social engineering. These phishing attacks that are happening at a rapid scale.
Yeah.
And what's happening is these attacks are so well designed that people fall for it every day. And we see people clicking on emails from that are external
Yeah.
that says, oh, the CEO says you need, Becky, you need to go get me a gift card from CVS, for $500 right now, and that's, she done drove to CVS without even verifying the email and picked up a gift card.
I mean, with a very focused social engineering campaign against a weak point in your organization, it's really little that you guys can do, right? You need multiple defense in depth. You need multiple security measures to defend even against that, right? Because I mean, if I said to the normal person, watch out for OSINT, right? People wouldn't even know what I'm talking about. Open source intelligence. Because people put all types of information on Facebook. People put all types of information on other social media platforms that I can utilize in order to get into your organization. Even LinkedIn is a huge resource. So say, for instance, you're an IT professional within an organization, right? I see that you recently posted. I can make a fake LinkedIn account, friend you, right? Start a conversation with you. I can see where your competencies are, right? Say, for instance, you have a lot of Cisco certifications or Juniper certifications, right? Then I see that, okay, if this person is a network security engineer, they probably are either a Cisco or a network shop. I mean, a Cisco or a Juniper shop. So I'm already developing some intelligence about what your current internal organization looks like. And I mean, from Facebook, I can see if you have children, right? If you have children, what schools does your children go to? Then I can get even deeper, right? Then this phishing campaign can be just be absolutely beautiful. Because I can say, hey, there's a situation at your child's school. It's an urgent situation where there's an active shooter involvement happening, right? To get more information, click on this PDF document attached. It's urgent that you click right now, or something, right? It can I can almost guarantee I can get into your organization if I have time and information about your internal organization and employees. The thing is that even if I do that, organizations need to look at, okay, now what? If they are able to have my employee click something and some malware is running on their machine, how do I stop that propagation? What are the defensive mechanisms do I have in place? It could be a 0 day. It could be something kind of wild, right? Not all the time. Every organization isn't targeted in that same way. You have to understand the threats that are possibly out there and be able to tailor your internal security to what threats are out. So it's multifaceted, right? You can't just say faster, bigger, stronger.
Yeah.
So,
yeah, it's a Kanye West theme, right? So
right.
What Gabe is saying is correct. This whole LinkedIn thing, social media thing. There was an incident that happened a couple years ago where a user posted on their Facebook that they were going on vacation, and what happened was bad guys were watching all this stuff. Man, that was a targeted attack.
Right.
Bad guys pull up with a U-Haul truck and start lifting things out of this person's house as they went on vacation, and the main thing they were looking for was the desktop and the laptop. They were able to get that stuff. The neighbors said, "Oh, you know, she's on vacation." Well, the bad guy said, "Well, she said that no, what did they say? We were just delivering furniture, right? We're from Jordan's Furniture or something like that, right? And they dropped, they Slim Jim their way into the house, and they breached and got that laptop and was gone, and got all the data off it. They able to decrypt it, and I don't even know if it had encryption on it, but it they got
full disk encryption, right? If someone is able to get to your machine, what type of encryption do you have on the machine where even if they get it, the adversary won't be able to access it, right? So yeah, who knows? Probably not. Normal person does not have like a BitLocker or anything on their machine, so yeah.
Right. So once they got all that information, man, all they had to do was just copy it over. They didn't even need to pull the hard drive out or anything like that. Just copy it all over.
Yep.
Right. You left your laptop. Right. You left your laptop in sleep mode. It was still actively running. Only thing they had to do was remote into it and stop pulling data from it. So these are the areas of concern when it comes to digital health and cybersecurity. So that's the fourth item on the docket. Fifth item is the roles and responsibilities of cybersecurity. We've gone over this already. securing data in transit, securing data at rest, infrastructure security, making sure all your IPSs, IDSs, firewalls, access points, making sure that your VLANs are separating your guest network from your enterprise network, so that people aren't downloading funny content to their devices and then trying to get on the same network. There has to be a separation of duties, as well as a separation of communications.
Yeah.
So these are areas of concern. If somebody decides to download or go to BitTorrent to go watch Game of Thrones because they're in China and they can't see it, or because they're in India and they can't see the full version of it, things like that happen. But what happens when they go to a torrent site and they carry that, they carry a potentially unwanted program into the workplace because they wanted to watch Game of Thrones? That becomes a problem.
It does. It might even plug a USB drive, just boom, plug and play right into the company network. Yeah.
Well, Quite just add something. Quite just add something really quick.
Go right ahead.
Yeah. Because brothers are talking about in the chat. Social media sites, you really need to be extremely careful with what you put on there and using them. They are some of the most unsafe networks you can use. I mean, again, we were talking about, in the chat, some brothers are talking about Facebook. I haven't used Facebook in years, partly because I've always known it was fad book. But even when I was in the military, they pretty much banned us from using Facebook. You can use Facebook. You can post nothing. You can put nothing up. It's only in recent years where they started to actually allow service members to post on Facebook. But when it first came out, I couldn't, I've had a Facebook account pretty much since the beginning, but I never used it. But again, especially in healthcare, this is one of these areas you'll get in trouble real quick. You see it happen all the time. You can dig up plenty of articles about it. Nurses getting fired, getting reprimanded, all kinds of stuff, for just posting the most benign stuff. Also because part of the problem is that these networks are extremely unsafe.
Yep.
Yeah, so what's the next item on the docket is number 5, which was roles and responsibilities. We discussed that already. The current state of cybersecurity, which is 6 on the docket. So the current state of cybersecurity, we just read about ransomware locking down people's systems and locking data away from the users, unless you pay a ransom, right? So that's what ransomware is.
You just paid in cryptocurrency or some type of digital currency, typically. Yep.
Also, social engineering. Usually social engineering. I know this is a black channel, but social engineering usually works best with white men than it does with black men or white women. It's very rare that a black man will be able to walk into an organization and spoof his way up into the upper levels of an organization. Very, very rare. Mostly because of the history of this country doesn't typically work well with that sort of attack vector. So usually innocent white women, blonde hair, blue eyes, maybe bifocals, fake bifocals from CVS or something like that, speaks with a soft voice. They're able to get their way into an organization or pull critical information out of a person, such as looking at their badge as they go to lunch, waiting outside.
Right.
Everybody's at the food trucks or something like that. Walk by, see a person's badge, see which building they go into.
Go to where they smoke. Start conversation.
Yep.
Tailgating in behind somebody. Act like you lost your badge. Yep.
Yep. That sort of deal. I've even heard about Russian women social engineering. Western businessmen. Same thing in Latin America. I believe the Secret Service was compromised several times under the Obama administration through social engineering of these Latin American women that they were dealing with. They would get drunk, and these girls would get their badges and their Blackberries or something like that at the time, and actually download data off of their devices,
Mm.
and leave them completely compromised.
Yep.
Pants around their ankles, panties on their face, and it's game over. They got you right where they need you.
Mm-hmm.
Yeah, could I just add another quick comment about that too? Because again, this is very, just talking about badges. If you're if you're in the health, if you work in the healthcare field, specifically you work in
Stop
a
wearing
health
your
system,
badge to
yeah,
lunch.
you have your badges. And again, to use computers, you have to scan. They scan your badge. You have to scan your badge or put your ID number in. So if you ever lose your badge, for example, you have to go through this whole process of like found like a lost and found type of thing. And yeah, but these are very important because just going along with cybersecurity and health systems, you know because because just by virtue of you being like a physician or a nurse, for example, you have access to so much sensitive information that losing your badge is it's like a security breach.
Oh yeah,
Because if
absolutely.
anybody finds it, it's game over.
I do even one better. I had so I used to work for so I'd have a DoD secret clearance, a Department of Defense secret clearance, but I had it when I was in college too. I used to work as an engineering co-op for one of the Department of Defense branches. So while I was there, I actually had traveled to I think DC. Where did I go? Baltimore and DC somewhere. I actually lost my CAT card. So CAT card is like how you access what you call like the NIPRNet, the Department of Defense federal systems. So you pretty much plug it into a card reader and you're able to access certain government systems, right? I lost it. I had to file a police report in order to rectify this whole that whole situation. So because someone could get it and be able to access some of those different systems. So yeah, I was in college, so doing dumb stuff. But yeah, it's serious losing these particular badges, not only organization but government level too. So yeah.
Yeah, I mean, we had badges with IDs when I was in the military. We had badges with IDs, and if you lost them badges, you might have gotten written up because they took that serious.
Yeah.
Because
new measures. Yeah, new measures don't actually have your picture on your ID anymore, on your badge anymore. So they separate that. So you keep your state ID with you, and that's a two-factor of authentication, right? So you have what you know and what you have is your physical item badge, and then what you know is your PII, right? So it's separate from that, and the badge. Most of these new badges don't have badge numbers on them. They just have your name and that's it, and they have access, right? So,
I mean, I'm sorry about that. Go ahead, brother.
No, go right ahead.
No, I was just gonna say because also too in the military, they were the first ones to start to put chips into badges, into ID cards and badges, that they used so you can use it to access your medical records. So your badge, your ID cards in the military had chips on them that actually had your medical records on it. So I mean, they was doing this they started this at least a decade or so ago. So they had been doing it for a while. So if you ever lost your ID card, you had to go down to the police department, everything. So it was a big deal.
It depends. It also depends on when you're working. We use 3-factor authentication. So your badge, your PIN number, and your biometric thumbprint.
Yep.
So even if you lost one, you're just not getting in, and all they have to do is terminate it. But your fingerprint and your PIN number doesn't really need to change so much. Although they do force you to change it every 4 months.
I see. Yep.
So you get random number generators as well. You can download that to your phone. Push alerts. So push alerts would be something like Duo, DUO. I think Cisco owns them now.
Yes.
So you can have a PIN number pushed to your phone.
Oh yeah,
we do the
use
same.
that at the place that I was at. That's what we use whenever you had to do a dual authentication if you logged in from a non network computer and stuff like that. So yeah,
to use your VPN. Yep, same. But like any system, really, I have to use my dual PIN in order to get access. So yep.
Yep. So you're using multi-factor authentication (MFA) to get into your systems, and that's where the roles and responsibilities of a cybersecurity person comes in, making sure that multi-factor authentication is enabled, making sure that there's high availability of those networks. If people cannot access their MFA, then they can't log in, then they're screwed, and business continuity comes to a halt.
And then even, I'm sorry, go ahead.
Right ahead.
Now, I was just saying, even for those who are listening, who are like interested in getting into the field, just this having these type of conversations and just being abreast of the information is important in just getting into the field. It's not necessarily you have to be an expert in, cryptography or steganography or any type of encryption, but a lot of it's just understanding some of the technologies, understanding the base concepts and the theory behind the security methods, and really then you start to focus in on the area that you really are good at. So
yep, Keep It Techie is in the chat. He's a system engineer, database engineer as well. So
okay. Peace, brother.
Yep, he just got his he just got his new opportunity, so that's why he's probably not on the panel right now. He's busy moving. He took another IT job out in West Coast. So congrats to him. He's in the Navy. So.
Oh, okay. Congrats, brother. Yeah, I mean, again, Gabe is absolutely correct. Just having these conversations pushes the dialogue forward. But again, understanding that, this is a wide open field for brothers. So you will find your space. And just understanding that, you don't have to do any of the stuff that, maybe necessarily we're talking about, but because this is just such a vast and massive field, you will find your niche and, and you keep it and you find it and you stick with it.
Yeah, so the roles and responsibilities vary for different organizations. Like one of the articles said, there's one guy for 2,000 plus people. That's not uncommon. If that guy goes out, guess what? If he goes on vacation or he gets injured or he gets sick, your organization is screwed because they did not invest into a junior analyst or something to that effect. So desktop support, not retraining. Not retraining these guys so that they can actually backfill on security incident response and things of that nature. Organizations just not spending the money. That's a part of the game. In healthcare, same thing. You have enough money for doctors and nurses and whatnot and other areas of the organization, but you would rather spend your money on new IoT devices and things of that nature than to actually hire more security professionals to protect all that data that you're managing. Most hospitals have at least 1 million, or I shouldn't say 1 million, but they have at least 1 terabyte of data that they're holding on to, and probably in various areas that they've generated over the years. But the matter here is that they've generated data that needs protection, and they have to, bring on more security guys to do it. Usually, I think what happens here is that guys who are sysadmins, guys who are network engineers, they're tasked with these responsibilities as security people. So rather than go out and hire a full security guy, they probably just have maybe a GRC guy, a governance, risk, and compliance guy who does some work in terms of security, but not the actual incident response, not the actual SecOps. That's usually tasked by network engineers and sysadmins and stuff like that. So,
and even another big one that's starting to emerge is that of threat hunting, right, within cybersecurity. So so for organizations, this is very valuable because you have an organization or individuals within your organization who have an understanding of the threats that are out there that could possibly affect your organization. So who might be targeting my company? Who might be coming after me? And what methods, what capabilities are they coming after me with? And this automatically feeds your intel. This feeds your organization the information that it needs in order to be able to be protected against some of those adversaries, right? So then you're able to start configuring, right, your intrusion detection systems, your host intrusion protection systems, your network intrusion protection systems, your SIM. You're able to start to look for certain information. And also you keep your eye, these threat hunters keep their eye on all the intel sources like Shodan, or they might even have particular accounts like anonymous accounts on the dark web looking for particular adversaries who might target their organization. So it's very vast and wide as it concerns the different roles and responsibilities within cybersecurity. But one is that threat hunters are very starting to grow more and more in this field.
Mm-hmm. All right. So next item on the docket would be
You sound sleepy, Mike.
my allergies are killing me, man.
Oh,
My allergies.
gotcha.
Yeah, I feel like I'm at war or something with hay fever. But so current state of cybersecurity and certs. Current state, as Gabe stated, is threat intelligence is huge. It's critical to any organization. So a lot of companies are being breached because they didn't have the ability to be proactive.
Yep.
So that's the current state right now. Is the lack of training and the ability to be proactive. Proactiveness comes from training, though. So if you're not investing in training, you can't be proactive.
Yeah, again, something that you and Gabe were talking about earlier, Mike, was about how your information gets passed around in healthcare. I can tell you right now, your information gets passed around all over the place. Health insurers everywhere. And if you guys, I'm sure you guys are aware of it, but there have been a number of health insurers who've been hacked over the last few years.
Oh yeah,
and these were some major hacks.
Small insurance shops. That's nice. That's a nice little target because they don't because they focusing on their business. They focusing on getting the money. They're not focused on protecting their infrastructure. That's beautiful.
Yeah, exactly.
Accountants. I mean, little firms. I mean, you name it. Startups.
Well, security slows down. Security slows down everything, right? And the article is not lying about that. It does slow down things because you have to go through these checks and balances, right? So they put security at the end, and then by the time security gets it, it's like this thing is so full of vulnerabilities. It's impossible for me to do a risk assessment is only the least I can do, right? So, what were you gonna say, Dr. Phoenix?
No, I was just gonna say no. Your brothers are absolutely right. I mean, in the healthcare sector, security is not typically prioritized.
Nope.
It tends to be one of those, I wouldn't call it low level, but it's kind of least on the priority list. And so again, now that we're seeing that, and they've known about this, health systems have known about this for years, that health insurers, health systems are at major risk for hacks and compromising of patient and user data. I mean, this is across the board. It's not just patients, but it's the workers themselves. The physicians, the nurses, the executives, all the other folks that are involved. So there's the ability for information to get compromised on all levels within the health system.
Exactly. So let me share my screen for those in the chat who are curious to know what we're talking about when it comes to certifications in terms of digital health. So CompTIA is the organization that is basically the standard for IT certifications in the industry. You probably did not get into IT without having some form of CompTIA cert. So it's pretty normal. So the Security Plus is one of these certifications that the government recognizes, DoD, as well as many organizations in terms of security. It's the bare minimum of entry into security from a fundamental standpoint. I know some of the government organizations don't allow you to either start or stay on site for more than 30 days without actually having your Security Plus. If you don't have it, you're not getting the job, you're not getting the call back, and you're going to get disqualified from the application process as well. So having the Security Plus is better than not having it. I know a lot of people have criticisms over CompTIA, but my personal opinion is it's better to have it and not need it than to need it and not have it.
Yeah, I agree.
So that's the CompTIA Security Plus. That's the not dedicated to digital health, but it's actually a benchmark in terms of security. So that's
Yeah,
one area.
yeah, just like Mike mentions, it hits on a lot of the fundamental information, right? A lot of the things that we were just talking about, right? Intrusion protection systems, encryption, securing data in transit or securing data at rest, being able to look at multi-factor authentication, two-factor authentication. What are some authentication mechanisms that exist? Threat modeling, like just doing some basic security configuration on certain types of network devices like routers or switches or even servers. So it goes over, just like Mike said, just a lot of the basic foundational information in terms of security. Just a good one to have. I don't have it, but I've heard good things about it.
Yeah, next one is from ISC squared, HCISPP. So healthcare security certification from ISC
Hmm.
is not as widely
Yeah, I was gonna say this one
adopted.
is new. Yeah,
Well, it's not new. It's actually pretty old.
really.
Well, I would say it's probably about maybe 8 years old at best.
Mm.
However, yeah, see, it says right here, please note, effective September 1st, 2019, the HCISSP or CISPP exam will be based on a new exam outline. The
Oh, okay.
domains and their weights have changed. Please refer to the um, exam outline. So they're already making changes to this because it's past its due date.
Yeah.
They usually change it every 5 years. So
Mm.
it's been around for a little bit of time, but it's better to. This is the pinnacle of healthcare security certifications because it focuses on security and privacy as a practitioner. I haven't taken mine yet, mostly because I don't work in healthcare directly. If I did, I would actually get it. Um, I think it covers the two areas of privacy, so the ability to understand security fundamentals from an organization standpoint, as well as the privacy of data. Those are two areas of healthcare, especially digital healthcare, that's going to be important because of all these regulatory standards that's coming in from GDPR, MDPR, CDPR in California. Russia also has, well, I shouldn't say Russia, what's the other country? The UK. I think the UK has their own data protection standards as well. So Africa has been talking about creating data protection mechanisms as well because they don't want their people being exploited, especially when you have 1 billion people on the continent. That is a lot of work. So there's
Hmm.
going to be long longevity in terms of cybersecurity in those areas and privacy in those areas because they don't want their people being exploited for profit.
Yep.
All right, this last one is the CIPP, so Certified Information Privacy Professional,
Hmm.
similar to what the ISC certification is, but it's independent of healthcare. But it does focus on a gamut of areas in terms of
Uh,
organizations.
I've not heard about this one, so this is new to me.
Yeah, this is usually at the GRC level.
Hmm.
Um, you probably usually at the corporate security level.
Who, me?
No, I'm saying that this is where the certification falls at.
Oh, gotcha.
This is where the certification falls at. It's usually at that GRC level, consultancy level, or at the corporate security level. So this focuses on the privacy of data. Basically, you're working out mechanisms to make sure you're masking a lot of the data that's being moved around. Seventh item on the docket is salaries of cybersecurity professionals. So,
Yeah, it's levels to it. But yeah, go ahead.
yeah, it's levels to it. Like Gabe said, anywhere between 60 grand and 200 grand. I've seen directors, architects, security architects making 200K a year. Not uncommon.
Mm-hmm.
I think $150 an hour is usually where they kind of average out at. Oh, you have anything you want to add to this, Gabe?
Yeah, I was gonna say, yeah, it's definitely so one is definitely based upon area. So you're not gonna get paid as much in like a Midwest or a South, especially the South. Like so, Florida versus like a New York or California, you're just not gonna get paid as much in security positions, as much in the southern states in comparison to those with higher cost of living. So you can very easily come out of college with some type of focus on cybersecurity as a major, making in the South, I would say probably like that they might mess you up, man. How you at 35, 40,000 a year, but then coming to New York or California or even a Chicago, man, you can start off at a good 75 or 80 as like a security analyst type of position, or maybe even a security engineer type of role. But then once you get more to that mid level, it's usually usually pretty decent to cross over as like an engineer, right? First year cybersecurity engineer, probably be pretty decent to cross over into those six figures or almost six figure range. But then just like
Well,
Mike said, oh, I'm sorry, go ahead.
no, I was just going to say that, when you mentioned Florida, but Florida doesn't have any state income tax, if I remember correctly. So
Okay.
salary would be definitely dependent upon that state,
Yeah.
Florida and Texas.
Yeah, they don't have income tax.
No income tax, sure, yeah. But Texas has a good market for security professionals, but I know Florida doesn't. I had a lot of different
Florida is
colleagues.
just weird, period. Even if you're physicians and nurses, they don't get paid particularly well in Florida. Florida's just one of those weird places in general.
Weird. Yeah. As and then probably when you start moving into those type of architect roles, again, it's based upon your skill set and what the needs of the organization is, just like you said. Yeah, it's really dependent. So it's kind of hard because I've seen some architects at right there at the six-figure range, like 100K or something. But then I've seen other architects at like that 150 range, right? Plus. But so it really ranges, and it's really not even based upon area, because a lot of these roles, and I don't know if you can attest to this too, Mike, a lot of these roles are remote. A lot of these more mid to senior level cybersecurity roles, you can be an absolute remote worker, working 100% from home. In my current role, I work actually in my current and previous role. My previous role, I was a security architect, and in my current role, I work as a senior consultant. And both of them have been 100% remote roles, where they just ship me all of my equipment, and I go out to customer sites on the need.
Right.
So, yep.
Right, and security architects usually have that leisure of working from home remotely, because they don't really need to be in the office at all for anything.
At all.
And they usually work better when they're alone. So
yes,
leave them alone, and they'll get a lot of their work done. But a lot of organizations would actually outsource their architectural designs on a per need basis. I mean, usually an organization may already have a network engineer that can do the architectural piece, and just needs a security guy that can come in and look at it and point out where the security gaps are going to be.
Yep, and then they assign it to an analyst or an engineer in order to implement whatever that guidance is. Yep.
Right. So, and that's why security architects are kind of like a it's a very niche factor sort of area to be in. Some guys like being riflemen. Some guys rather be the guy managing. I know most security architects don't like to be in managerial positions. They don't like the political aspect of it. So they stick with architecture, and then they limit themselves in terms of growth.
Yeah. So that was a lot of my experience as a security architect, because I felt the only person I would see on a daily basis was my wife. It's the only person I would see. only person day in and day out. And sometimes if she worked, because she's a nurse, working 12 hours, I wouldn't see anybody. I'm just siloed. Like they send me, I mean, I had like 2 30-inch plus monitors, had my laptop, had all the equipment I needed, had all the training I needed. Everything was in one place. And I was absolutely siloed from the world if I desired to be. And I'm like, yo, this is not this not the move. And I would just remote into all of the devices, do my configurations, send off reports. They even had me do penetration testing from home. They would ship all the equipment to my house. And they say, oh, here's all the licenses to the tools that you need. I mean, you name it. If you want it as a security architect, usually organizations get it for you. But it was just something where I didn't have any human interaction. That's why I decided to move on to more of a consultancy role, because I'm like, I need something more and more human interaction. So just from personal experience.
Now, typically, if you're outside of what Gabe and Mike does, I mean, these brothers obviously have backgrounds in cybersecurity, but if you're a clinician, if you're a nurse, or if you're a nurse, for example, and you're looking to move over into that tech area of the game, you know, typically, specifically if you're working in EMR, electronic medical records, and the big player in the field is Epic. I've seen folks who are in like health informatics that are nurses that moved from the clinical over to that side, generally starting off somewhere in the I say 90s to 6 figures easy. There's most of the stories I heard, most of the folks I've known that have started out, they start out in the 6 figures, and you know it just goes up from there. So, you know, again, not quite cybersecurity, but again, because this is about dealing with digital health, and EMR is a massive component of that. You know, if you decide to move into that arena, you know, you get a lot of physicians that are moving out of the clinical side as well, not just nurses who want, you know, you get tired of seeing patients because you get burnt out. And so they're moving over into those fields as well. And, you know, you're easily seeing 6-figure salaries there. So.
Yeah. And I would also like to say there's a distinction, because sometimes those numbers get a little skewed, because there is a distinction between that of like permanent positions or contract positions. Because if you're working in a permanent position, usually the salary is a little bit less than, well, not a little bit, significantly less than if you're working a permanent role. So contractors, you know, companies don't have to pay anything for their health insurance. They don't have to pay. They don't really have to invest in you, and your time for employment is a certain period of time, and then they can choose to renew your contract or cut it off completely. Well, with permanent positions, they're like investing in you to be an internal resource for them. So those salaries are a little bit less. But for security architects, I would say in general, once you get to that type of level, yeah, just as Mike was saying, it's usually like that 150 plus type of number that you're requesting from an organization.
Yeah, and to add on to what Gabe is saying is that when you have contractor versus perm, FTE versus LTE, full time versus limited term in employment, if you have a full-time person, yeah, they get paid significantly lower because they get bonuses later in the year.
Yeah,
the company does well, right? I've seen up to 20% bonuses for some guys. So, yeah, you might be getting paid 70, and the contractor might be getting paid 100, but that 20% bonus kicks in, and those vacation benefits kick in, right?
Yeah.
Paid vacay.
You don't get paid for vacation as a contractor. Yep.
Yeah, unless you saved up enough money or something. But it is what it is. So. Most organizations are moving to contracted regardless of who they are, especially in the healthcare field. All of the people that are working at the organization that I work at are contractors. No matter how high level they are contractors. So it is that's the way the market is moving. That's the way they see it. They keep people off the books. They wash their hands free, and they don't have to pay for these people's vacation. Those people are usually pretty young, anyways. Young, dumb, and full of stuff. And you know, they don't have kids, so they don't really care. They live fast, man. So
I actually contracted for a good about 3 years, 3.5 years, and yeah, I wasn't married. I still don't have any kids, but I wasn't married, no kids or anything, no type of long-term responsibilities. And that resulted in me just being able to move around. Like I went from I did a contract role in Detroit, contract role in North Carolina, contract role in Pennsylvania. I mean, I'm just moving all around. I almost went overseas to Abu Dhabi for a role over there. And again, just paying just money type of thing, right? You could just get paid and keep it pushing while you're also being able to travel. So, but I think that a really good strategy is that I think everybody should probably, well, a good thing in security is that when you're contracting and you're moving around to different organizations, you have an exposure of different environments, right? So that makes you a bit more marketable than your possible peers who've only been with one organization the entire time, because it was previously seen as if you stay with the same organization for a long time, they like you, they want you to be there, they want to hire you, you're more marketable. But now a lot of organizations see if you move to different organizations over a period of time, you have exposure, you have proven success with multiple organizations, you can be a little bit more marketable in comparison to your peers who've been in the same place the entire time. So
Yeah, I think just to even speak to what outsourcing you see in the healthcare sector. I mean, it's across the board. It's not just the folks like the brothers Gabe and Mike that are in cybersecurity and IT. It's even when you consider folks in my position. I mean, you see it all the time. You get travel nursing, you get contract nursing, you get contract physicians, you get contract nurse practitioners and physicians assistants. And I mean, for example, we talked about telemedicine earlier. I can tell you right now, I have personally spoke to folks who do telemedicine, telepsych, and they were easily racking on an additional $3,000 to $5,000 a week on top of whatever they do for their regular job. Yeah. So I mean, and I was regularly seeing 150 plus an hour.
Yep.
So I mean, these are very lucrative fields. Again, they're not sexy, and Gabe was talking to one of the brothers in the chat, about what things he should start with first. Understand these things take time. You develop over time. You're not just gonna walk into this making 150 grand a year. It takes some time to get there. And so, no matter which route you decide to go at this, just understanding, the major goal of this conversation is to help brothers understand that there are just so many opportunities out here in the tech healthcare, field. And, and again, we're usually Johnny come latelys in that regard.
Yeah.
Yeah. Let me see. What's the next one on the eighth one on the docket is resources and networking. So LinkedIn, meetup.com, Eventbrite. LinkedIn, make sure your LinkedIn is tight. Make it marketable. Any of those certificates or those professional programs on EDX that I mentioned earlier in the live stream is that those, when you pay for those certificates, they go straight to your LinkedIn. So employers will see that immediately and see that you've passed that with passing grades, and it'll say, yeah, that's the guy that I'm looking for, because he or she is fresh and ready for that industry. And at least get you an interview. What happens after that interview is up to you. Meetup, I recommend Meetup, for the guys or people looking to network, because it's important that you network in IT. So digital health is an emerging market, and I know we have digital health meetups here in Boston all the time. I know there's some in Atlanta, so you should actually check your zip code when you go to meetup.com and look up in your area. Download it to your phone from the App Store, and make sure you put up a picture, because most meetup groups won't allow you to join unless you have a picture up. Next one is Eventbrite too. So Eventbrite is good for one-time events. Definitely download that to your phone and kind of search by keywords like tech, IT, information technology, healthcare, security, cybersecurity, data science, data engineering, things like that. Use those type of key buzzwords to actually seek out events in your area. Most of them are free. Some of them you do have to pay, but it's a very small price to pay, less than a super chat. And I don't always I don't use Facebook, so I don't even know what events goes on there. So I couldn't even really tell you. But
Nothing
webinars,
new.
yeah, yeah, webinars are actually really good. To actually collect CPEs for one, and number two, just good knowledge. To listen to other people talk about certain areas that may or may not fall in line with your line of work. I work in cybersecurity, but I still go to Windows server administration meetups and stuff like that, just to hear what's going on, because I'm curious to know how they're going about securing their operations, their business operations, in terms of like Windows Server and Exchange and things like that.
Mhm.
You have anything you want to get to that, Gabe?
Well, I think InfoSec Twitter is big. I know that it was interesting. I think I might have mentioned this before, but just being interactive on Twitter, just kind of posting different articles, maybe putting a couple of your thoughts, retweeting people's like some thought leaders within your field, putting comments under people's things and liking certain things. That really helps in kind of getting your name out there. Where even for my last position, I was interviewing with somebody who I was already following, and they were following me on Twitter. And we've already previously had conversations about things that were happening in the industry. So he already had an introduction to me even before I sat in an interview with him. So it just made the whole process very, very easy. And just kind of mentioning that network and building that network of individuals, I think definitely for cybersecurity and they call InfoSec Twitter, Twitter is a very good place. You don't have to get into any of the social media politics. You can set up a professional Twitter, just like a professional LinkedIn account. And you don't have to mention anything else as it concerns your life. I know I don't talk about anything personal on Twitter. I talk about everything professional. So I think that that's a very good resource to use in building a network of individuals who are currently talking about what's happening in the industry. And also Reddit. Reddit is a very good place. Yeah, I'm subscribed to a lot of what you call subreddits that are very focused on the areas that I work in. So it really helps to inform me. Being an informed security practitioner is very important, because it's one thing to just go day to day to your job and be able to configure firewalls and be able to implement regulatory guidance within your environment. But it's another thing to be able to know the current trends within your organization or within your field, and being able to leverage that into other positions and more interesting positions within security that you're interested in. So yeah, just a little ad there. That's all. Hello, Mike, you there?
Yeah, I'm here, brother. I hear you.
Oh, okay.
Yeah, I'm
I
here.
thought it was my mic.
So no, I was just going to say that so it's closing thoughts now in Q&A. So my closing thoughts on this would be digital health is we're at the cusp of digital health right now, and the transition is happening. So getting your feet wet in these fields, making that transition over is actually this is a good time to do it, because automation is coming in and sweeping a lot of those jobs that most Black people work for in menial tasks. The digital health market is actually going to scale between now and 2022. I think upwards of maybe $100 billion or something like that. So if you have any technical skills, that's going to help. If you have any customer service skills, that's going to help, because of telemedicine and teledoctoring, things of that nature, telenursing and stuff like that. So those are going to be critical areas of expertise that soft skills that these companies are going to look for. I think these are great opportunities for Black people to get in and dominate.
Again, just to address a couple of the brothers in the chat, yeah, it is very possible if you're like a physician assistant, nurse practitioner, physician, very possible to, I mean, to make anywhere from, if you're not even really trying, like 10K a month on top of your regular salary if you do telemedicine, telepsych. I mean, I was watching a video, I think it was yesterday when I was at the gym, um, where they were talking about the state of telemedicine and telepsych in Texas, and brothers that have been in Texas, so you guys are familiar with Texas. Texas is a major hub
Yeah.
in the healthcare sector, in the healthcare tech. Well, just across the board, you pick it, it's a major hub.
It's in
You know,
Texas. Yep.
and it is very possible. Yeah, I've talked to folks where they were making upwards of 20K additional a month just doing telemedicine, telepsych on the back, just part time. Because why? Because telemedicine and telepsych are, especially telepsych, you would not believe how many people are medicated for psychiatric issues, for neurological psychiatric conditions. You would not believe it. And if folks want to make some solid six-figure money, if you don't want to go spend, the 15 plus years to become a physician, go be a nurse practitioner. Probably take you about 6 to 8 years or so, and you be either a family nurse practitioner. You start doing some telemedicine, easily seeing salaries 125 an hour, 150 an hour. If you want to make the big bucks, go do telepsych. If you're a psychiatric nurse practitioner, first of all, your starting salary is going to be somewhere between, I've seen it between 100 grand and 130 grand starting. And on top of that, folks typically do telepsych on the side, easily tacking on another 10, 15 plus on top of your salary. So these are very real. But again, these take time. They're not gonna give you the ability to come in and and prescribe medications to people. This takes time. And so for any of the young brothers in the chat, or folks who are, they're going off to college, they don't know what they want to do. These are very strong fields. Young Black people need, especially brothers, need to be considering. The great thing about, if you did nursing, you're double minority. You count, because one, you're Black, and two, you're male. So I mean, and if you're a veteran, you're a triple minority. So, you know, there's all kinds of things that happens within that sector. So again, these are just things that, from personal conversations I've had with people, that I've talked to people in these fields, what they've talked to me about, and just kind of, just putting me up on game. So, again, just sharing it with brothers. So, these are all exploding areas, in the current and as we move forward.
Gabe, you have anything you want to add for your closing thoughts?
Yeah, man. Just I think there's a lot of interesting things within the cybersecurity field. I mean, it's so vast and wide. I mean, not only necessarily in the work that you do, but a lot of, even in the salaries. Like, just speaking about you, I used to think, coming from the hood, that you made it if you got six figures, right? You made it if you get six figures. But I think that within these type of fields, I mean, you can make easily, I wouldn't say easily, of course, but you can make 300K, and not even necessarily be a C-suite individual. You can do this by just increasing your expertise and moving where the security field moves. So, I think that, yeah, man, it's just super duper vast and so interesting to kind of work to secure individuals' data, people in general. And, I think it's just a super duper interesting field. And the sky's the limit, salary and interesting work to do. Yeah.
Interestingly enough, we just got a thumbs down, so I'm curious to know who
Whoa.
actually give a thumbs down to
I started every time I talk, because that happened last time. I was saying something and somebody thumbs down.
No, I don't think it was you. I think it was I think there's somebody who just doesn't like the brain trust at all.
Yeah.
I find that to be very interesting that we got a thumbs down, especially on a day like this, on a hangout like this. So yeah, I think from a Q&A standpoint, man, we pretty much covered questions and answers in terms of salaries and places you can get your certification and education as well, certificates and stuff like that. You shouldn't have too much of an issue getting into this area if you're doing your due diligence in terms of studying. So I think digital health is something that, Black people aren't even talking about this anywhere else on social media, but I do think that it's a very important area that brothers need to be focusing on in order to get themselves established because this is going to go for the next 20, 30, 40, 50 years. This isn't going to stop. This is going to be an area that's going to continuously see high growth rates, especially with all the emerging technologies that are coming out.
I will even add that I would go out on a limb and say that this will become standard practice in the future. Telemedicine, telepsych, all of these areas will be standard practice for for the next generation of clinicians. You're going to see this as just part of your everyday practice. And so, again, we as Black people and Black men specifically, we're stand to be probably the most affected by these technologies by far.
Mm-hmm.
If there's anything, let me see if there's anything in the chat before we just shut this down.
Oh, I will also say too, in areas of telemedicine, that's what I meant to put up. When we talk about healthcare, don't count out health departments neither, because they are a major. They're not technically health systems, but they do function like such in many respects. But also understand there's a lot of the telemedicine practices. You're going to see them in a lot of the opportunities. You're typically going to see them in some of the more rural areas. Iowa parts. A lot of Texas. A lot of parts of Texas are rural. The Midwest, some of the upper Midwestern states. These are areas that are going to be prime spots for folks who are in those healthcare practitioner roles who are interested in telemedicine, telepsych, where you're going to see some of the greatest opportunity, even to an extent. Florida is as wacky as Florida can be. So.
All right. I don't have anything else. So what I will say is that thank you all for joining us. Hit the like button if you have not already done so.
The marathon is concluded.
Yeah.
Yeah. Again, thank you, brother Mike V, for having me on. Always appreciate it, brother. Always.
Absolutely. All right. We'll see you tomorrow on Cannabis, Black Cannabis Talk with Complex Design and Anti-Gravity.
That should be interesting. That should be interesting because I'm part of a LinkedIn group for nurse entrepreneurs, and I know for a fact there are a lot of nurses and healthcare practitioners that are moving over into that field. So that should be interesting.
Nice.
Yep.
All right, man. I'll see y'all later.
All right. Have a good one.